Iliotibial band, iliotibial band, iliotibial band, otherwise known as the IT. It's a big problem child, and when you can pronounce it like that, smart is the new sexy. So in this video, I'm going to show you how to release your IT band. The IT band is oftentimes a culprit of a lot of knee problems, and it can be from internal or external rotation, and this is also one of the ones that are kind of controversial, whether you should foam roll it or not, causing more damage, more harm than good. I have found in my time working with people that foam rolling the IT band with consciousness and making sure that you're not going beyond what it can handle, you can get a lot of really beneficial results. And what you see here is a white foam roller. This is one that I talk about in my how to foam roll video. If you haven't watched that, I suggest that you take a few minutes and watch my how to foam roll video that says the best things that you need to know as you embark on a foam rolling practice in this series. But the white foam roller is what I choose for the iliotibial band, or even a softer foam roller. We want something that has give, especially if there is pain in the knees or the hips. So the IT band runs from the top of the hip down to the bottom of the knee. And to begin with rubbing the IT band, I highly suggest that you use the top leg as a form of release valve. So if you can't handle so much pressure, you can use the top leg and your core muscles to sort of lift your leg off and not create so much tension. So straight down from the top of the hip to the side of the knee is going to be the IT band. You may find that by rolling a little bit forward or a little bit back, that you can identify areas that feel tighter than others. That's because there's muscles from the front of our body and the back of our body that attach to the IT band. They help internally and externally rotate our leg. Not needing to know all the anatomy once again, know your body. Know your body by exploring and moving forward and feeling that tight spot. And then when you do find it, breathing, relaxing, and waiting to see if it'll melt. They say it takes somewhere between 30 and 60 seconds for one of these spots to release. And if you're simply going back and forth, you're not doing yourself any good. Find the tight spots and then stopping and breathing. Sometimes I like to talk to the muscles and say, it's okay, you've done such a good job, but you can relax a little. It's time to let go. I find that muscles respond really well to communication. And right about here is where I'm feeling my tightest spots. Now, if you go through and you're finding from knee to hip that it's just simply not that tight, you can increase the pressure by lifting both legs up. Having both legs allows more weight on that. Woo! And there we go. As soon as I see somebody's face contort or they make a grunt or a noise, that's usually the spot that you don't have to move far from. And you can simply play in that area, remembering to stay at a level 2. And then the key with the IT band, and pretty much all muscles in your body, is that you want to work it daily versus trying to fix it all in one day. And you're going to need to do this for a couple weeks in a row. However, if there's a place in the IT band that feels bruised, and you're trying to massage an already inflamed, bruised place, it's probably better to give that part of the IT band a break, a day or two, let it feel better. Epsom salts baths are great, and then you can go back to it and work it a few days from now. So just stay away from any places that feel bruised and really consciously, slowly work into working your IT bands open and free. Let me know what you experience if you decide to use what I suggest in this video, and please feel free to explore all my other videos about health and wellness. Cheers!